Trauma is a powerful force that can alter our lives in profound ways. When we experience a traumatic event, our brains can undergo significant changes. These changes can lead to post-traumatic stress disorder, PTSD, in some people, but not everyone. But what exactly happens to the brain during this process? To start, trauma activates the amygdala, which is the brain's fear center, and signals danger. This triggers a fight or flight response, which releases hormones like cortisol and adrenaline. Meanwhile, the prefrontal cortex, which is responsible for reasoning and problem solving, can struggle to activate in some people. This imbalance of a very active fight or flight response without our ability to think through the situation makes it difficult to regulate our emotions and process the traumatic experience. Think of it as being like a seesaw, with the amygdala weighing heavier. The hippocampus is an essential part of the brain when it comes to PTSD and is involved in our autobiographical memory, so it helps us remember in what order things happen in our lives and plays a role in our stress response. Chronic or severe stress from trauma can damage this region, impairing the brain's ability to differentiate the past from the present. This means that a supersensitive amygdala, so really sensitive to that fight or flight response, can react to reminders of the past as if the trauma were happening now. This is why flashbacks and vivid memories are common symptoms among PTSD. You can think of the hippocampus as being kind of like the filing system of our autobiographical memory. So it's like a linen closet that's been overflowed and we're trying to keep the door shut, so that when we experience reminders of the trauma, the amygdala reacts as if the memory is happening now, as opposed to recognizing that the incident happened in the past. The human mind actually can bounce back from traumatic events if we expose ourselves to reminders of the traumatic event to right-size our beliefs about what happened. For example, if Jane Doe were in a terrible car accident, she might have traumatic-like symptoms, and she also might have beliefs about what she could have done differently and maybe blaming herself as the accident being her fault. Because of these thoughts and beliefs, Jane may feel inclined to avoid getting in a car or avoid the area in which the incident occurred, and this would actually prolong symptoms and stop the recovery process. Now, if you think about it on the other side, if Jane's job or her sense of identity or her sense of self was highly dependent on her ability to drive, she may be unable to avoid driving or talking about the incident, causing her beliefs about the incident to change in a way that's more balanced and realistic, and leading to a reduction in symptoms naturally. However, if after a year Jane continued to avoid thoughts and reminders of the trauma, her symptoms are unlikely to improve without therapy. This is why therapy for PTSD is so critical to recovery. I specialize in cognitive processing therapy, which helps us explore our thoughts and beliefs about the trauma that cause or maintain and keep PTSD symptoms going. The treatment helps us use our prefrontal cortex, or the critical thinking area of our brain, to regulate our amygdala by thinking through the incident rather than avoiding our thoughts. This process helps us reorganize the hippocampus so that our brain is able to recognize our experiences in the past as having been in the past. With a reduction in symptoms, a more balanced, realistic view of the trauma, and a more realistic view of ourselves, others, and the world, we can live a balanced, richer, and more full life. If you'd like to see more videos or schedule an appointment with us, follow us on socials and check out our website.